So this is Tracy. She's 36 weeks pregnant. Congratulations. So what we're working on today is some labor preparation. And we always do this in the last trimester, usually starting at about 36 weeks, which I've talked about before. And how many weeks are you?
36.
Great. So we're going to work on 4 groups of points today. The first group is going to be to relax the muscles and tendons to get you nice and relaxed for your upcoming labor. The second group of points is going to be to increase circulation to the pelvic organs, to get the pelvis ready for labor and start to ripen the cervix for labor. The third group of points is going to be just to relieve some anxieties that Tracy may have. Now, this is Tracy's second labor, and most of us are going into our second and third labors with preconceptions and previous experiences that we might need to let go or might be apprehensive about for this labor. And some of us are first-time moms, so it can be a nerve-wracking experience. We want to make people feel as calm as we can going into labor. And the fourth group of points that we're going to work on is anything specific, day-to-day issues, fatigue, swelling in hands and feet, headaches, lower back pain, and anything like that. So what is ailing you today?
We're going to be dealing with blood pressure today.
Okay, so do you have high blood pressure?
Yes.
Okay, so what has your blood pressure been?
It's been about 140 over 87 to 90, depending.
Okay, so in that situation, what would happen?
Well, the doctor's looking at possibly putting her on bed rest, so I'd like to try and get it under control and help that out.
Okay, so acupuncture can treat high blood pressure. It's called pregnancy-induced high blood pressure, hypertension. Especially if the woman doesn't have a history of high blood pressure going into the pregnancy, it's a lot easier to treat. So if it's happening at the end of pregnancy, then it's something that we can definitely work with. It just takes about 4 points on the body, and we often treat it at the clinic and see some good results, not all the time, but we can always try. So we're going to be working on that today. So the 4 groups of things. Does that sound good?
Perfect.
Is there anything else you want to add in?
No, that's good.
Okay, good. So the labor preparation is about we do hour treatments once a week from 36 weeks all the way until 40 weeks because it's important to go into our labor feeling good. And when you have a newborn, you want to be in the best that you can be, or in the best condition that you can be. And another thing is that having a good experience during labor and feeling good going into a birthing experience or labor can cut down on the likelihood of you having postpartum depression. So we want to make sure that we do that. Yeah, so we're just going to get started. So we'll start with 2 points on the bottom of the feet because we want to ground the patient when we're doing acupuncture. We're going to start with the bottom of the feet. So those points there connected with 2 points on the crook of the elbow on the top of the arm are the points that we're going to use for pregnancy-induced hypertension. Important that this is a relaxing experience. Often I'll be treating people for labor preparation and they'll go home and say that they feel fantastic, the best that they felt in a long time, because of the end of pregnancy can be really hard. So we want to make it as easy as we can. So these are the points that we're using for hypertension, and then we'll add a couple more points in after this and let Tracy relax for about an hour. My name is Dr. Courteney Kenning. I am an acupuncturist here at the Holistic Institute of Health and Fertility, and I specialize in fertility and prenatal acupuncture.